Hello, this is Kim Jong-il. We are going to cover the topic space closing methods in MEAW. The first part is the upper canine retraction. In the premolar extraction case, treatment will be performed as follows. 1. Initial alignment. 2. Space closure. 3. Finishing. At this time, the process of closing the extraction space consists of the upper canine retraction, lower and mass retraction, and upper anterior teeth retraction. The ways of closing are as follows. First, there is a sliding method, closing the space along the arch wire, and a loop method, closing the space by bending the loop. There are advantages and disadvantages to the sliding methods and loop methods. In the sliding mechanics, it is not necessary to bend the wire, so it enhances patient comfort. Patients would feel more comfortable. It doesn't take a long time to initially engage the wire. It would be better for patients. However, there will be some problems as follows. First, friction will occur. Second, it is still controversial for the optimum force level. The force will decrease as time goes by. There are some factors affecting the force. Also, by using elastics and springs, overactivation could occur. It is slower than loop mechanics. In the case of energy chain power chain, the color is likely to be changed when eating curry or any other foods. On the other hand, the merit for loop mechanics is no friction. Closure of the extraction space is much faster than sliding mechanics. The problems are as below. First, it's not easy to bend the wire. After wire bending, it is likely to be pressed by gingiva or mucosa. By applying loops, it is more difficult to maintain oral hygiene compared to sliding mechanics. According to the teeth movement, for closure of the extraction space of lower, sliding mechanics are generally used in the MEAW treatment. Because maxillary incisors are likely to be extruded and can be lingually inclined, we must use loop mechanics to close the space of upper. There are two methods to close the space. First, we can close the space by moving entire anterior teeth as one unit. In this case, it is called en masse retraction. The space can close with one phase. On the other hand, the space can be closed in two phases. In other words, because upper and lower canines are very strong teeth and the roots are very long, the space can be closed in two steps by first moving upper and lower canines backward and then moving anterior teeth left. In general, MEAW, in the stage of space closing, en masse retraction is used for closing the lower space, closing the space with one phase. In the case of closing the upper space, the space can be closed by first moving upper canines backward or by using en masse retraction in the upper as well. The most common problem caused by closing the space in the upper and lower is the loss of incisor torque. Center of resistance in the anterior teeth would be placed in the root of the lateral incisors. So, when the space is closed, the bracket is already placed on the labial side of the crown. As the space is closed, the upper incisor would rotate clockwise and extrusion. This will be a big problem. First, there are two ways to move upper canines backwards. We can use an E-chain energy chain, power chain, and closed coil spring as well. There is an advantage by using closed coil spring, gaining continuous force, but it's hard to maintain oral hygiene. In the beginning, it would be good for patients, but a month later, you would realize that it's hard to control the oral hygiene because of food stuck to archwire and bracket. Of course, the energy chain is good for oral hygiene in the beginning. The problem, however, is that it would lose most of its energy in the next treatment. Each method has its own advantages and disadvantages. Therefore, I usually choose an energy chain closed type to move upper canines backwards. So, like this, an energy chain can move upper canines backwards. At this point, friction should be considered due to sliding mechanics. By considering friction, a little less or more of 200 grams or, if possible, lighter force should be applied. If the upper canines are moved backwards, the gradient of the bracket and slot differs. Then, the upper incisors will be extruded. If extruded, this would result in losing torque in the upper incisors. You should keep that in mind and move the upper canines backwards. When we move the upper canines backwards, we should think over the next three things. 1. Whether to reinforce anchorage or not. 2. Whether to apply heavy force or light force. 3. What would do if the upper canines touch lower teeth while moving the lower canines? The anchorage would be reinforced in the first case. Many patients visit the clinic due to protruded lips. Many practitioners try to move only anterior teeth backwards, leaving molars unchanged because canine and molar relationships are class 1. But in MEAW, UOP and POP are evaluated separately. This patient has 11 degrees of UOP, normal UOP, and 18 degrees of POP, steep POP. What does steep POP mean? It means that lower teeth are inclined mesially. What will the upper second molar be? We can see the distally inclined upper second molar. Many tend to set the appliance to upper tooth number 7 like this due to protruded lips. This is because the greater root surfaces on the posterior teeth number 5,6 and 7 than those on the anterior teeth number 1, 2, and 3. The distance that anterior teeth move backwards is longer than the distance that molars move forward after first premolar extraction. What will happen if the appliance is attached to the upper second molar? There would be not only pros but also cons. While leveling or after leveling, the extraction space should be closed. What will happen to the upper incisors while leveling? If extruded like this, torque would be lost. While closing the space, if extruded, torque would be lost, and it could be worse. Therefore, many use mini screws. It is not easy to prevent loss and extrusion of the upper incisors, even though mini screws are used. What does this blue line mean? It is the midpoint of the upper first molars and incisor edge of the upper incisors. This is upper occlusal plane UOP. The UOP of this patient is normal. If the space is gradually closed while maintaining this normal UOP, upper anterior region would be more aesthetic. I do not recommend moving upper canines backwards from the upper second molars in the case of steep POP. It's better to close the space maintaining the upper occlusal plane, rather than reinforcing the anchorage. Many close the extraction space by applying an omega loop to maintain, reinforcing the anchorage. Of course, it is also possible However, it is needed to adjust on every visit. In the MEAW treatment, it is recommended to close the extraction space while maintaining the UOP. So, it's not preferable to attach the appliance to the upper second molars in the beginning stage of treatment. In summary, when the upper canines are moved backwards, it is not necessary to attach the appliance to the upper second molar. If necessary, mini screws and TPA can be used. So the extraction space should be closed like this. When the space is closed, we should change steep POP to be flattened. How should it be moved to make steep POP flat? In the case of the upper first molar, it should be moved forward and uprighted. How about lower first molar? It should be moved forward, uprighted, and intruded. Like this, it is recommended for the upper first molar to be moved a little forward. Do we have to use mini screws or not? It will be decided after covering the part of anchorage, which will be mentioned later. Because it is allowed the upper first molar to be moved a little forward, I do not use mini screws or TPA except for special cases. It is likely to apply heavy force when closing the space due to the large size of upper canines. However, optimum force level in the upper canines is smaller than that in the upper first molar. This is because the root surface in the upper first molar is much wider than canines. Like this, black dotted line is the optimum force when the upper canines move backwards. What will happen if you apply heavy force? The upper first molar is more likely to move forward more than the upper canine's red dotted line. Of course, it is necessary for the upper first molar to move forward, but we don't have to do it on purpose. And it is recommended to apply light force if possible. There is malocclusion showing half class 2 and full class 2. In this case, the upper canines may touch the lower canines. Therefore, if upper canines are moved backwards, the upper canines may touch the lower canines, causing the molar move forward, not backwards. You should evaluate whether the upper canines touch the lower canines. Furthermore, the crowding could be observed while moving upper canines backwards. That is why many move upper canines backwards until they touch the second premolar. It is recommended that the palatally displaced upper lateral incisors should be aligned after upper canines are moved to some degree. It would be preferable to move the upper canines after aligning. When eliminating occlusal force, we should check if we can place the bracket to the proper placement or not. And upper canines should be moved backwards properly. Crowding in the maxillary lateral incisors is often observed. In this case, by using open coil springs, the space can be secured and canines could be moved backwards. While doing this, it is recommended to attach and align on upper lateral incisor. However, if the appliance cannot be placed in the accurate position on upper lateral incisor, you should think of the solutions. There are 3 options that you can use. 1. To use anterior bite plate. 2. To attach the appliance after placing blue resin or composite resin on the upper or lower first molar region for eliminating occlusal force. 3. To eliminate occlusal force by using posterior bite block in the lower. The appliance that eliminates the occlusal force can be chosen according to the skeletal pattern. In the case of resin bonding, the only target tooth is intruded. For the short-term usage, composite resin is used only 1 to 2 months. For the longer-term usage, anterior bite plate, posterior bite block, and twin block is recommended. Anterior bite plate can be used in the case of low-angle deep bite, high combination factor, usually non-extraction case. In the case of premolar extraction, because the combination factor is low, use of the posterior bite block is recommended. If the posterior bite block is used, what will happen to the lower molars? The lower molars would be intruded and the lower incisors would be extruded. The occlusal plane turns counterclockwise. It is likely for the mandible to move forward. It would be a good sign for the Class 2 premolar extraction treatment. When moving upper canines backwards, we should refer to the three pictures following. First, in the case of attaching the appliance to the maxillary tooth, number 1, 2, 3, 5, and 6. I mentioned that the appliance is not placed in the tooth number 7. Second, if there is crowding in the area of the tooth number 2, the appliance is attached to the tooth number 1, 3, 5, and 6, but number 2. Third, the appliance is not attached to upper tooth number 1 and 2, but 3, 5, and 6. We should remember the three cases above. In the first case, if there is no crowding observed, the appliance is attached to tooth number 1, 2, 3, 5, and 6 like this. The center of resistance is in the lateral incisors. What will happen if the upper canines are moved backwards? The space will be closed, but the upper incisors would be extruded and turn clockwise. To prevent cases like this, some use mini screws. When using mini screws, upper tooth number 7 is also included. If so, upper incisors themselves would be more extruded. In the second case, if there is crowding in the upper, the appliance wouldn't be attached to the teeth with crowding. If attached, the upper incisors would be extruded. What will happen if an open coil spring is used instead of attaching bracket? The canines would move backwards and incisors would move forward. While doing this, if a power chain is used together with, the upper incisors wouldn't be extruded and can prevent the loss of torque. To achieve this, we don't have to attach the appliance to the upper lateral tooth with crowding in the beginning. In the case of crowding, by using an open coil spring, the upper incisors can be moved forward while pushing the upper canines back. Open coil spring is used with a power chain together. Then, incisors would be prevented from being extruded and loss of torque. In the third case, the appliance is not attached to the tooth number 1 and 2, and only upper canines are moved backwards. What will happen if only upper canines move backwards? Upper canines would move backwards like this because the appliance is not attached to the 4 incisors. After the movement, the inclination of the bracket slot changes. It is also observed for the arch wire in the anterior region to be extruded. The upper incisors can be prevented from the extrusion because the bracket is not attached to the anterior region. The appliance can be attached to the upper anterior teeth later for the patients with steep UOP, gummy smile, extruded and normal angulation of the upper incisors, especially in adult patients. This patient has Class 1 high angle. U1 to lip line is 8.4 and UOP is 19 degrees, which means steep UOP. There is a limit to non-extraction. What if we intrude the upper anterior teeth by using mini screws? Can we move the upper anterior teeth backwards? The limitation is clear. In this case, if the appliance is attached to the upper four incisors later, they would be intruded and moved backwards. The molars move a little forward, and the lower anterior teeth can be moved backwards. Then they can be moved, and it would become more aesthetic. When the upper canine is retracted, you attach a bracket on upper canines, second premolars, and first molars in the beginning. Initial arch wire would be 040 NETI. And next month on 016 SS, the upper canines are moved backwards. 016 SS is a weak wire. The space in the upper canines is not fully closed, and it becomes a class 1 canine relationship. And then, move the teeth by a half amount of the space and change the upper arch wire. It is called a combination loop. 01602 SS arch wire is used. You should remember that the upper canines shouldn't move to where they touch the second premolar. If it moves a halfway, it should change to a combination loop. Many try en masse retraction of the upper arch, and often use mini screws. What would happen if the lower canines move backwards first? Would it be good or bad? The space can be closed easily. However, if lower canines move backwards first, the canines can become a full class 2 canine relationship. If so, it becomes more difficult to finish later. So even though it is a class 2 relationship, it would be more preferable to move the upper canines backwards a little first. First, move the upper canines backwards, leading to class 1 canine relationship. Then perform en masse retraction for the 6 or 8 of the lower anterior teeth. After that, retracting the upper 4 incisors is the standard of MEAW treatment. To review, there are 3 steps when moving the upper canines backwards. First, the appliance can be attached to upper teeth number 1, 2, 3, 5, and 6. It is a case with normal UOP and the upper incisors with labioversion. Second, the appliance can be attached to upper teeth number 1, 3, 5, and 6, and an open coil spring can be used in the tooth number 2. It is the case of crowding in the lateral incisor area. Third, the appliance can be attached to upper teeth number 3, 5, and 6, but tooth number 1 and 2. When is this recommended? It is preferable when the patient has steep UOP, upper anterior teeth have normal angulation, and has a gummy smile. It is more preferable for the patient to have non-extraction treatment, but sometimes extraction is needed. In this case, the appliance should be attached to teeth number 3, 5, and 6 first after delayed boating like C. So, it is recommended to have a class 1 canine relationship by moving the canines backwards first. Thank you for watching.